Hi, everyone. My name is Amanda Kowalski. I'm the Director of Behavior Programs for San Diego Humane Society. Today, I'm going to be presenting on separation-related problem behaviors in dogs and cats. This webinar is being presented by San Diego Humane Society in collaboration with Purina. Purina is a leading partner in San Diego Humane Society's life-saving work, providing the highest quality nutrition and cat litter for the nearly 40,000 dogs and cats who enter our shelter every year. In addition to ensuring that our adoptable animals are well fed, Purina is also partnering with San Diego Humane Society's Behavior Center to investigate best practices for challenging behavior issues in dogs and cats, including fearful and anxious behaviors. Together with Purina, we look forward to sharing our findings with shelters nationwide so that animals everywhere who need specialized training in behavior intervention can get the help and second chance they deserve. In this presentation today, we will go over what separation-related problem behaviors are, what factors may lead to separation problems in your pets, what it might look like in dogs and yes, even cats. We will go over some management strategies, examples of what treatment can look like, and how to find help if you believe your pet may be suffering from separation issues. One of the most common topics our behavior and training team is asked about is how to resolve separation-related problem behaviors. The term separation-related problem behaviors is an umbrella term used to describe the range of behaviors your pet may experience that stem from fear, anxiety, and panic when your pet is left alone and separated from you. There are multiple behavior conditions that fall under this umbrella, including anxiety when confined, isolation distress, and separation anxiety. The term separation anxiety is used interchangeably with the term isolation distress, and while both describe distress behaviors when left alone, there are some differences that are important to point out. Separation anxiety is a diagnostic term used by a veterinarian or a veterinary behaviorist. It is often seen in dogs but can also be seen in cats, and it is a very common behavior disorder, so common that it's reported that 20 to 40% of all clinical cases seen by a veterinary behaviorist consist of dogs that have separation anxiety. Dogs and cats are social animals, and any social animal can be prone to experiencing distress when they're left alone from an attachment figure. Dogs and cats who suffer from separation anxiety are experiencing an emotional distress response every time they are separated from their primary person. Essentially, they're having a full-blown panic attack each time, and it's not a very nice feeling for them. Animals with true separation anxiety simply cannot be left alone, even with another person. They just don't find any comfort in having another person there and are really only interested in being reunited with their primary person. On the other hand, when we're talking about isolation distress, the dog or cat is still experiencing distress when left alone. However, one of the main differences between separation anxiety and isolation distress is that the distress will subside with the presence of another person. So even if their primary person leaves and there is another member of the family or visiting friend, they will most likely be content and won't display separation-related behaviors or experience distress. Another common condition to make note of is confinement anxiety, which generally occurs in dogs, but cats can also experience anxiety with being confined. Confinement anxiety is usually characterized by frantic attempts to escape from a confined space. Dogs or cats that have not been properly crate trained or need some additional help feeling more comfortable with being left alone in a confined space like a crate or an X-pen will display anxious behaviors related to being crated. What they are feeling is very similar to humans experiencing claustrophobia when in a confined, tight space like an elevator or even on a plane. It's not uncommon for animals newly adopted from a shelter who are still transitioning into their new homes to be a bit uncomfortable with confinement, especially in a new environment. In most of these cases, by reinforcing relaxed behaviors and gradually building up their duration in the confined space, this will change the animal's conditioned emotional response from a negative one where they are experiencing distress to a more positive one where they can be more comfortable and relaxed. I want to mention this because it's easy to confuse confinement anxiety with isolation distress or even separation anxiety because the behaviors can look the same and the animal is still experiencing some level of distress and panic. It's just that the underlying reasoning for why they are experiencing that distress or panic is for a different reason, and that means treatment would be slightly different. So for the rest of this presentation, we are going to take a zoomed out look into separation-related problem behaviors. There are a few myths I hear quite often, and I want to address these before diving any further into the material. The first myth is that pets are acting out or being spiteful when their owners leave them alone by barking, whining, howling, showing destructive behaviors, inappropriate elimination, the list goes on. The unfortunate fact is that these behaviors aren't a sign of your pet being spiteful or vindictive or trying to get back at you for leaving. They are behaviors that stem from anxiety and the fact that they cannot cope without you. There are other reasons why your pet could be displaying behaviors, like medical reasons, boredom, maybe other dogs in the neighborhood barking and it's upsetting your pet, scary sounds outside, or even incomplete house training. But because they want to get back at you for leaving them alone isn't one of them. Another thing that I hear quite often is that adding another pet will solve your pet's separation problems. Honestly, I wish this one was true, and while I know for some people this may have been true, usually in cases of isolation distress where any person or maybe even a pet might do. But as far as we know, dogs or cats that suffer from intense distress or panic will not be comforted by another person or another pet in the home because their distress is stemming from being separated from their primary person. In worst case scenarios, you could actually end up with two pets with separation issues. And finally, letting your pet sleep in your bed will cause separation-related issues. So there's no known association between letting your pet sleep in your bed and them developing separation issues. Sleeping in your bed won't necessarily solve the issue because the goal of treatment is to help your pet feel relaxed when alone, but it's also not necessarily going to make it worse. So what are some reasons why an animal might be experiencing separation anxiety? Any dog can experience separation issues at any point in their life. Genetic predisposition, and environment play a role in dogs developing separation issues. Studies have indicated that dogs who have had single attachment figures being separated from their litters too early, have had major changes in their routines, moved into multiple homes with other owners, and had multiple owners, or have had a traumatic experience are all contributing factors to separation problems. Just like dogs, any cat can experience separation-related issues, although the cause of separation issues in cats is largely unknown, and at least at the time of this recording, there is no known data supporting what may be contributing factors in cats. We can assume that genetics and environmental factors play a role as well. Kittens who are orphaned, bottle fed, or weaned too early might be more prone to separation issues. And similarly to dogs, cats who have lived in multiple homes, had multiple attachment figures, major changes to routines or traumatic experiences when left alone may also be more prone to experiencing separation-related issues. So what can separation-related problem behaviors look like? Dogs with separation issues display signs of distress that can include the following: destruction directed in the home and directed towards exit points like windows and door frames, escape attempts, excessive barking, whining, howling, urination or defecation. It's important that medical issues or incomplete house training is ruled out. Repetitive behaviors like pacing, hypersalivation and panting, not wanting to eat, and withdrawal or inactivity. Dogs may also display behaviors like shaking, trembling, following their owner around the house, or avoiding them if they're trying to place them in confinement. Some dogs can also get so stressed out about being confined and their owner leaving that they may start to show aggressive behaviors during departure routines. As for cats, they will show similar behaviors like excessive vocalizations like meowing or yowling, inappropriate elimination, destruction, over grooming, not wanting to eat, withdrawal, or or increased attention-seeking behavior, like following their owner around. I will point out that pets that follow their owner around the house like a shadow doesn't predict or confirm that they have separation issues, or an absence of these behaviors don't rule out separation issues either. I've seen both. A dog who's attached to their owner like Velcro be completely content with their owner's departure, and other dogs that are pretty independent when their owner is at home become total wrecks when they leave. Another thing to mention is that most dogs will exhibit signs of distress within 30 minutes of their owner's departure, but because there isn't much research available regarding cats and separation-related issues, it's unclear whether or not this would be the same for them. So, what do you do if you think your pet is experiencing distress when left alone? It's important that you work with your veterinarian to rule out any possibility of underlying medical conditions. Your dog or cat could be displaying any of the distress behaviors I previously mentioned because of pain or discomfort, or certain illnesses or even undiagnosed conditions. I recommend setting up a camera and recording your pet while you're away so that you can get a good idea of what is happening at home or around your home, as well as seeing exactly what distress behaviors your pet might be displaying. There are some really great and inexpensive home security cameras that are perfect for recording your pet. Because we really never know what's happening at home when our pets are alone, it's possible that they could have experienced something scary when you were away, like construction sounds or fireworks, and now they have a strong reaction to something in their environment. Some other examples include another dog barking in the neighborhood that's upsetting your dog. Some cats will display stress-related behaviors if a new cat has moved into your neighborhood. Recording your pet is so great to figure out these types of details. Once you have a recording, you can also share this with your vet to help them rule out any other concerns or confirm a disorder like separation anxiety. Once you've ruled out any medical concerns or even other behavior concerns, a solid management plan will be important during the treatment phase. A management plan usually consists of providing adequate daily exercise and play sessions, whether that is taking your pet out for a walk, and yes, even cats can be harnessed, trained so that they can go out for walks in the neighborhood, or exercising them in the house by playing fetch, using a flirt pole, or simply running around. Besides physical exercise, other forms of exercise include consistent training sessions to learn basic cues or tricks, food puzzles, noseworks games, or scavenger hunts. You'll want to be sure that you're feeding your pets during consistent feeding times, and your cats especially are getting their litter boxes scooped daily and can be completely changed every 1 to 2 weeks. Finally, it's important that your pet is not experiencing any anxiety-provoking departures during the treatment phase. For some pet owners, this can be difficult. This could mean that an owner may need to work from home during the initial stages of treatment, or have a friend or pet sitter stay with their pet. Other considerations to preventing anxiety-provoking situations is bringing your pet to work or having your dog go to daycare. I also want to make a quick note about safety. For any pets that are displaying escape behaviors or destructive behaviors that can result in an injury, having a safe alternative to your pet staying alone, like at a friend's or in a different environment that doesn't elicit any anxiety-provoking behaviors, will be very important. If it's not an option for you and they must be left alone, then trying to avoid spaces with large glass windows or metal bars where they can get their teeth or nails caught. This might also be a situation where you speak with your veterinarian about potential pharmaceutical options. So once you've created your management plan, the next steps are to begin the treatment stages. An example of treatment includes teaching your pet to go to a designated safe space and stay there while relaxed during departure. Essentially, we're teaching a stationing behavior like a sit or down stay in a specific place with duration while your pet remains relaxed during your departure. The animal trainers at San Diego Humane Society teach a relaxation exercise called the magic blanket. This is an exercise that can be used in so many contexts, but it's also really helpful for this early stage of treatment and teaches your pet to stay relaxed in a specific space, and you can build on this behavior. Let's watch a clip from a training session with a dog at the Humane Society. In this first clip, Chris is simply teaching the dog that the towel means good things. He wants her to start investigating it and getting comfortable with stepping on it. There are actually some treats hidden in the towel, so when Chris places the towel down, the treats are already there as a reinforcement for approaching and stepping on the towel. While you're teaching your pet to be comfortable with going to a designated spot, it's important to keep in mind a few things about criteria and when to start raising it. Building a behavior like going to a mat and staying calm and relaxed, especially for an animal that is experiencing anxiety, is a slow process. You need to go as fast as your learner and be mindful of your criteria for distance, duration, and distractions. When building a skill like this in your pet, you'll want to focus on one of those criteria at a time. So if you're working on building duration, like in this video, you want to be sure that you're not also trying to build distance and distraction. For the learner, it's too much to process all at once, so we teach these things separately and then put them together so that we can have a really nice, resilient behavior. For this particular dog, we can see that she is very distracted and trying to learn this new skill when she can hear other people and other dogs in the area that she would like to interact with is similar to trying to study for a test in a bar. You're not going to retain much. So the next session we have with this particular pup, we would want to make sure that we're in a distraction-free environment so that she can learn the new behavior. Again, this early stage of treatment is to teach your pup to go to their safe space and remain relaxed. Once your pet is reliably stepping on their mat and offering a down, the next steps for this relaxation exercise is to continue adding duration and distance. Technology like the pet tutor pictured here can be a game changer for behavior modification and reinforcing calm behavior from a distance. Here is an example of how we are using technology, like the pet tutor, to help with building duration for a settled behavior. And for this particular dog, we were working on him being alone and confined in a crate. This is Bubba, who came to the Humane Society due to his severe separation anxiety. Bubba's first owner sadly passed away, and his adopter came to us for help because Bubba had severe separation anxiety, so severe that he jumped off a second-story balcony and injured his leg. This video is after weeks of working with Bubba daily to build up his behaviors so that he was comfortable with staying in the crate and left alone in the room. The pet tutor is mounted on the side of the crate, and by using our smartphones, we can dispense treats to reinforce calm behaviors from even outside of the room that he's in. The next stage has to do with changing the predictive value of your departure cues. Departure cues are any sounds you make or actions that you start to do before you leave your house. Sometimes even smells from perfumes or coffee can act as departure cues. Our pets are experts at reading body language and picking up on the patterns that you have before you leave the house. This is why pets with separation-related issues can start to display anxious behaviors before their owner even leaves. They are noticing patterns and anticipating departures. So, for example, your departure cues might look like using a hair straightener, making your coffee, putting on your shoes. Depending on the individual animal, they might pick up on pre-departure cues just minutes before you leave the house, and others might pick up on your cues even an hour or two before you leave. Each departure cue is going to be assigned a different value or cause a different level of anxiety according to your pet. To prep for working on changing your pet's emotional response to departure cues, start making a list of notable things you do to prepare before leaving the house and note what your pet's reaction is and their intensity. For instance, my dog likes to lay on his bed in the morning when I'm getting ready for work, and he seems barely interested in anything that I'm doing, but as soon as I put on my shoes, he starts to follow me around. And if I grab my backpack, he runs straight to the door. Now, my dog doesn't have any issues with being left alone. However, those are the cues that signal to him that I'm leaving for work and it's time for him to go too. He just so happens to come to work with me multiple times a week, and he's picked up on this pattern of behavior from me. Once you've identified any significant cues for your pet, you can start working on changing the value of them one at a time. Focus on the ones that are causing the most anxiety. So, for example, if shoes are anxiety provoking for your pet, put your shoes on and take them off. Repeat until you start to notice neutral or calm behavior. Then you can work on putting your shoes on, stepping to the door, and then taking your shoes off. Because of the nuances to working with separation issues, I recommend working with a veterinary behaviorist or an animal trainer or behavior consultant experienced in separation-related problem behaviors. They will help you determine the right steps to a treatment plan that fits you and your pet's needs. Finally, the last stage has to do with practicing graduated absences. Essentially, you are working on building up the time your pet can be left alone with you out of sight. So, for example, you might be able to start at putting on your shoes, grabbing your keys, walking to the door, touching the handle, and returning. You'll move on to the next step when your pet is relaxed or is neutral, seemingly unfazed by this. The next step would be adding walking to the door, opening it for a brief second, and closing it. Again, when your pet remains relaxed and unfazed, move to the next step, which might be walk to the door, open it, walk outside, close it, wait 1 second, return. And a final stage could be walking to the door, opening it, walking outside, closing the door, waiting about 5 seconds, and then returning. You're gradually building duration, and at this stage, you are literally building up by 1 to 5 seconds. These beginning steps are so important because they are building a solid foundation for you to strengthen this behavior and continue to build duration. If you move too quickly during these steps, you could experience setbacks. Once you have a solid minute, you can start to jump time in larger increments. And once you have about 15 minutes of relaxed behavior, you can jump even more time. Again, for separation-related behaviors, I highly recommend working with a behavior professional that has experience with creating behavior plans for animals with separation-related behaviors. And that's because each case is going to be slightly different. I do want to make a note about using bark or shock collars. Punishing your pet by raising your voice at them or scolding them, or even using equipment like bark or shock collars when they're experiencing stress and anxiety will only cause more behavior problems and mistrust. We highly discourage the use of any bark or shock collars because they may suppress anxiety-related barking or sometimes make it worse, and it doesn't solve the underlying issue that your pet is suffering from and will ultimately delay any treatment and resolution. I would also like to address the use of medication to treat separation-related behaviors. This is a great conversation to have with your primary vet. There are several medications available to support a behavior modification program for separation-related behaviors in dogs and cats. And at the Humane Society, we have seen a significant benefit from their use with many cases. The choice to use medication is personal and should be discussed with your veterinarian. There are various factors that may dictate whether you want to consider medication, but in any case, following a solid behavior modification plan is the most important component of treating separation-related problem behaviors. Medication alone won't take care of the problem. It literally is not a magic pill. I also want to address alternative calming aids. There are multiple options that can be added to a behavior modification plan. I have a couple listed on this slide. Feel Away and Adaptil are synthetic pheromones that help to encourage calm behaviors in pets. They come in a spray form that could be sprayed directly on your pet's bed or the mat that you're using for the relaxation exercise. We also use Purina's Calming Care at the shelter, which is specifically for dogs, and it's a probiotic that you could sprinkle over their food once a day to help with reducing anxious behaviors. Neither of these options are medicine, So it doesn't alter their personality or make them groggy. It just helps them be less afraid of things that used to trigger them. For calming care specifically, on average, it takes about 6 weeks to take full effect, but every dog is different. We've seen results as soon as 3 weeks. The dog does need to be on it every day, and once it's out of their gut microflora for about 3 days, it stops taking effect and you have to start over. The nice thing about any of these products is that you don't need a prescription, but it's also worth mentioning if you're using any of these products to your behavior professional that you're working with. You can find them on Amazon, Chewy, or at any specialty pet retailer. Veterinarians, veterinary behaviorists, and behavior consultants may recommend considering adding one of these products to a behavior modification plan. Lastly, the $1 million question: how long does treatment take? Well, it's highly variable and it can depend on severity. Treatment is slow in the beginning. Remember, you're building a strong foundation. If you had to assign a time, I would say that treatment can take weeks to months to resolve, and it requires maintenance. The important part to know is that there are treatment options for separation related problem behaviors. Many cases have resolution, and there are professionals that can help you and your pet. Here are a few websites that I recommend to find a professional to help. I also encourage anyone looking for a behavior professional to ask about the individual's experience with separation related problem behaviors and their training philosophy. Again, methods grounded in punishing or suppressing the behavior will result in increased anxiety. So I encourage you to work with a behavior professional that uses positive reinforcement. And finally, if you're not sure where to look, you can always reach out to your local Humane Society for help. Some have dedicated behavior helplines to provide support and guidance to members of their community. San Diego Humane Society offers a free behavior helpline for pet owners that need help getting started, need advice on their pet's behavior, or resources and recommendations on how to find a positive reinforcement behavior professional in their area. And our helpline is open to anywhere in the world who needs it. Thank you so much for your time today. Until next time, stay well.